So we noticed a number of patients that shared physical findings that we're seeing in the craniofacial clinic, in the medical genetics clinic, in order to understand what was causing the problems and in order to help the patients. There was no clear genetic cause that explained any of these findings, but what these patients shared was a prenatal exposure to fentanyl. Their mothers had an opioid use disorder and used fentanyl throughout the pregnancy. And so after we saw a number of patients that shared physical developmental findings without an identifiable genetic cause, we're thinking that the significant prenatal fentanyl exposure due to the maternal use disorder was what caused these differences.
What does fentanyl do to a fetus?
That's an excellent question. Some studies have been done for other opioids, and we know that other opioids can result in a small birth weight, possibly an increased risk for cleft palate, possibly a cleft foot, maybe some cardiac defects. But not a lot of work has been done on fentanyl itself because it's a synthetic opioid, and the opioid use epidemic with the fentanyl has fairly recently taken off. So we don't know that much about what fentanyl does to the baby in the pregnancy.
How can we know that this is fentanyl that's causing these differences?
We have to do a lot more work to document this. One will be we have to find other patients who share similar stories. The second part of it will be there's a lot of lab work that needs to be done to show that indeed fentanyl affects the cells, and probably also in animal studies that it affects fetuses in animal studies that needs to get done. So there's a lot more work that doesn't directly include the patients, but background work, lab work that needs to be done to prove this. And ideally, we would have large cohort studies looking at these pregnancies, monitoring them and monitoring the outcome. That would be an ideal approach. However, the problem with that is that it's hard to get these mothers into appropriate prenatal care. Obviously, you would prefer the moms don't use fentanyl or opioids during the pregnancy. So this is very challenging, but maybe the CDC can help with that.
What are the differences that you're go through some of the specific findings of these similarities that these babies have?
So it's starting with a relatively small size and a small head size at birth. Physical findings including the very short nasal tip, a small jaw, and a cleft palate. We also noted that in their hands they have a single crease on the palm on both sides, and that the thumbs are relatively short and a little bit held in an adducted position. The foot position is often abnormal with a club foot or talipes or a rocker bottom foot, so that's something else that we've seen in a number of these patients. In males, there can be some differences to the genitals, and the children have significant feeding difficulties. Most of them require a feeding tube for a prolonged period of time. In addition, we found some biochemical abnormalities in lab samples that were drawn really early when the babies were very young. And we think that that's an indirect reflection of the fentanyl exposure during the pregnancy, but we have yet to prove that. A lot more work is to be done on that front.
Are the babies born addicted to fentanyl?
They typically have neonatal abstinence syndrome with irritability and neurologic abnormalities. Yes, that's being treated in the NICU.
What's the importance of this finding?
So for us, it is really at this point just recognizing that there can be this effect on children. Step one is recognizing it, and then there's going to be a lot more work that needs to be done in studying how it affects many people. In light of the fentanyl use epidemic, I'm concerned that there are many more undiagnosed patients out in the country that need to be recognized. And then clearly the next step will be to help these moms not to use fentanyl during the pregnancy. So long term, I'm hoping that this will really lead to changes in support for the people who have opioid use disorders.
Is this the first time this kind of finding has been documented?
For fentanyl, it certainly is. There are analogies, for example, for fetal alcohol syndrome. That is a condition that was recognized in the 70s, very similar by seeing patients that had shared findings, no genetic cause, but prenatal exposures. So I see a lot of parallels in that sense, in that first one has to recognize the condition in the most severely affected patients, and then one is able to make the connection, make the diagnosis in the more mildly affected individuals, and then one is hopefully able to draw from that to help women not have these exposures during the pregnancy. So I think there's a lot of similarities between this and fetal alcohol syndrome, and that it needs to be recognized and understood better.